Very good morning, everyone. I'm Dr. Nandini Devi. I'm a consultant gynecologist and fertility specialist from Indira IVF Chennai branch. Today, I'm going to talk about the tubal block, what causes this, and what are the symptoms of this tubal block, and how can we diagnose, and what are the treatment options available. Before that, I would like to emphasize on the preventive measures for coronavirus infection. That is, wearing mask properly and washing the hands frequently, and also maintaining the social distance. Coronavirus infection second wave have come. So cases are increasing daily. It is very important for us to maintain these preventive measures. And we at Indira IVF follow these preventive measures, and we are there to help you with your fertility related issues. And if you have any fertility related queries, do contact the number given below. Now let's move on to the topic, the tubal block. The fallopian tube are the small noodle-like structures present on either side of the uterus, and a normal functioning fallopian tube is very important because here where the fertilization takes place. Each month the ovary releases egg, and if the husband and wife have contact, the husband deposits the semen in the vagina. From there, the sperm ascends up and crosses the cervix, crosses the uterus, and reaches the tube. And here it fertilizes the egg and becomes an embryo. This embryo grows in the tube for 4 days, and by 5th or 6th day, it reaches the uterus, and here it implants and becomes a beautiful baby. So, normal functioning fallopian tube is very important for the natural conception. And this tubal block accounts for 40% of the infertility cases. And now coming to the causes for this tubal block, infection plays an important role in this tubal block. We live in India. India is more common for tuberculosis, and this tuberculosis affects the 90% of the tube and causes a tubal block. And other infections like sexually transmitted infections such as gonorrheal infection, chlamydia infection causes tubal block. And if the infection following any abdominal surgery or infection following miscarriage or termination of pregnancy also causes the tubal block. And previous history of ectopic pregnancy also causes tubal block. And patients with endometriosis also have tubal block. And coming to the symptoms, usually women doesn't have any symptoms, but sometimes if the patient who are having the pelvic inflammatory disease or who have endometriosis may have lower abdominal pain or pain during periods or pain during defecation or pain during intercourse. Okay, coming to the diagnosis, HSG is a specialized X-ray. Here we inject a dye into the uterus, and it has to spill in the peritoneal cavity via the fallopian tube. And if there is a block in the fallopian tube, the spill may not be noticed in this X-ray. And saline infusion sonography is another option for diagnosing this tubal block. This is a specialized scan, and when the patient has tubal block with these diagnostic tests, this is not confirmatory. So laparoscopy is a confirmatory test. Here we can see the tubal block by ourselves, and if there is any endometriotic spots or any adhesions, we can remove that as well in the laparoscopy. But this is invasive test. And coming to the treatment options, the treatment option always depends on the age of the patient and how long they are trying for the pregnancy and where is the block and how bad is the tubal block and how bad is the tube. Okay, so if one tube is blocked, we can try naturally also, but better option would be an intrauterine insemination. And if the two tubes are blocked, and if you ask for any surgical option is there or not, yes, if the block is in the proximal tube, we can do proximal tubal cannulation. But if the tube is in the mid tube or in the distal end, or if the tubes are extensively damaged, it is better to move with the IVF ICSI option. And also we have to consider the sperm parameters. If the sperm count is low and morphology is low and the tube is badly damaged, it is better to go ahead directly with the IVF ICSI option. And if the patient is having hydrosalpinx, that is tubes filled with the fluid, and this patients may have repeated vaginal discharge, and this patients we can proceed with IVF ICSI, but before that we need to remove the damaged tube, or we need to disconnect the connection between the uterus and the tube. And if the patient is having these are the options for the tubal block. And if you have any queries regarding the same, you can contact us with the number given below. Thank you.